Well, good morning, everyone. Thanks everybody who joined. For whoever's there in person, thank you so much. Sorry I can't meet you personally, but my name's Jackie. I'm one of the nurses here with the Medina Healthcare System, and just excited to have some classes available to bring to the community and hopefully just let somebody walk away with something new. Today we're talking about fall prevention, and our awesome Director of Rehab Services and Physical Therapist, Miss Tanya Moore, is going to present for us. She is a wealth of knowledge, and we're just super excited to have her. Tanya, thank you so much for joining today and for helping present this class for us. Thank you.
Sure, glad to be here, glad to do it. So, all right, with that, we'll just go ahead and jump on into it. So like Jackie said, my name is Tanya Moore. I'm a physical therapist. I've been a PT for about 21 years now. So we've seen a little bit in fall prevention and things that we can do to kind of make it better and give you a little tips today. So first, we'll start by looking at some of the common risk factors that have been known to help cause some falls. So we'll just go through this list, and then we'll kind of go through each one of these things individually and kind of discuss them a little bit further. So footwear style, any kind of pets that you might have running around the house, rugs or carpets are a big one. Any kind of bedding that might be dragging the floor, even though it's really beautiful. Thresholds, like we said, we'll go carpets, any kind of wet floors, clutter on the floors, and extension cords. These are kind of some of the big ones. So let's kind of dive into each one of these a little bit and discuss them a little bit further. So footwear style. A lot of times people like to wear slide type shoes, like house shoes, especially if you're not leaving the house very much. Those little house shoes that you just slide on that don't have a back on them are really notorious for letting people trip. Any kind of shoe that has a heel that you're not used to wearing it, but you're getting dressed up because you're going somewhere and it has a little heel and you're not used to that type of heel, or any kind of shoe that has a worn grip that will help you kind of slide a little bit where you don't have good traction. So make sure that you're picking a shoe that you can get on all the way, that you can tie the laces if they have laces or do the Velcro on them, and that PTs, we like the ones with the back. We don't like any kind of backless shoes like Crocs or something like that. So the ones with the backs are the best. Next is pets. So we all love our little furry friends, but sometimes they can get in the way a little bit, especially if they've got lots of energy or they don't have any energy at all and they want to lay in front of you. Sometimes they can be in the way because they don't like the walkers, and so they will bark at walkers and that sort of thing. So make sure that your animals are out of your walking area when you're getting ready to walk, and make sure you know where they're at so that as you start walking, they don't try to run between your legs or something like that. Have somebody kind of put those up for you or hold on to them while you're getting up and moving around. Next one we'll visit about is thresholds. So on the right, we have a couple examples there of thresholds. So this house has a little threshold, the top picture. And so they bought these little ramps to put on there on either side to make it a little easier for the walker to go over. It's not only just for walkers, it can be just for regular people that are not using an assistive device. It doesn't have to be for somebody who's relying on a device to use these little ramps, but they kind of give you a little bit of a grade on there so that you're not stumping your toe and that sort of thing. If you do have a threshold and you don't need the ramps, you may consider using a bright colored tape or something to kind of mark it so that you're like, oh yeah, I forgot that threshold's there. I really got to pick up my foot before I take off. So the next one is rugs and carpets. These are my least favorite. So any kind of little carpets, like the carpets that you use in the bathroom by the toilet, or sometimes people have them by their bed so that they don't get cold feet when they first get up in the morning, that sort of thing. Those little carpets are notorious for kind of slipping and sliding as you're getting ready to move on them. So be cautious about that. if you absolutely have to have the carpet, sometimes, patients would be like, I have to have this carpet because it's by my toilet, in case there's accidents or something like that. Use some double-sided tape. They sell some specific stuff to be able to put on the back of the rug so that it's non-split, non-skid, and that will help also. You can also use a bigger rug. So instead of just using a little rug, that's a smaller one, you could get something that's a little bit heavier, but doesn't have a whole lot of pile or thickness to it. And that will help some also. If you are using an assistive device like a walker, if you're using one of the more traditional type walkers that have the gray kind of piping on them, I guess I would say, you can get walker sliders. They look like little skis that you can get in the pharmacy department and stick those up underneath those back legs. A lot of people use tennis balls because they're readily available. And so just be sure that if it starts sounding like something is sticking on there, you've probably worn the tennis balls out and that they need to be replaced because they will wear holes in them or lose the yellow felt part off of them, and then they will start sticking. So you can also buy larger walker wheels. So there are walker wheels that are like 3 inches, which is kind of the standard one that the walkers come with. And you can buy ones that are 5 inches and replace those, and that makes it a little easier to maneuver around. All right, some more small changes that you can do throughout the house is making sure that you don't have any wet floors. So if you're mopping or cleaning, or somebody in your house is mopping and cleaning, you want to make sure that those floors are dry before you start walking through that area. If you're taking a shower, a lot of times the showers will leak if you're using a shower bench or something like that. The water will still kind of spill out onto the floor a little bit. Make sure you're putting towels down to make sure that that floor is dry whenever you get out. And definitely always ask for assistance or supervision if you need it, or if you're unsure. You would rather be safe than have a fall. And then make sure whenever you're washing your hands or you're doing dishes or something like that, that you're taking your extra time and not being careless with the water and stuff so that it's spilling out onto the floor. The next thing is clutter on the floor. So sometimes we end up saying, okay, I'm going to take these things upstairs. Like the top picture up there is kind of clutter on the stairs. I'll take this upstairs. When I go up next time, I'm just going to pile it up right here. And it ends up being a little bit of clutter. And before you know it, you don't even realize that you've used most of the stair for kind of a storage place. So any kind of magazines or paper that end up falling on the floor, those kinds of things, and even the pet urine pads. If you have small pets in the house, those pet urine pads can get very slick because of that plastic underneath, to keep the floor from getting wet. It will definitely make you fall down and slip. So, and then the last thing on here with the small changes is cords. So lots of times people will have extension cords run over areas like main walk areas. So if you're going to have an extension cord for some type of appliance that you need, try to put it in an area where you don't walk as often, or even get a longer cord if you have to, and go around things, go around the baseboards or something like that, so you don't have to have it in the main walkway. And then be cautious too about temporary cords. So I've actually had a patient who was using the ironing board. The phone rang. She went to go answer the phone. She forgot the iron was right there and tripped over the iron cord. So just because it wasn't in her normal area. So just be cognizant of what you're doing and where you're putting it at, and all safety things on there. All right, so this is a little video of a fall recovery. So let's say you've done all of those things and that you didn't think you were going to have a fall, but now you found yourself on the floor. This is a little video that's going to go over kind of the best way to try to get up. So let me see if I can get it started here.
Hey, Tanya, I don't want to throw a wrench in anything, but I can't hear the video on my end. I don't know if it's playing on your end.
So you can't hear it on your side, Jackie?
No, ma'am. I see
Okay.
it playing. I just can't hear the audio.
Okay, well, then I can walk you through it.
So
So
sorry.
it's all good. It's all good. Let me kind of get to a part here. All right, so we'll kind of start here. So this person has fallen and now she has a family member that's going to try to get her up. So the best thing you want to do is to try to get on your side. You're going to end up trying to get on hands and knees, or quadruped as we would call it, and use a sturdy piece of furniture like a chair or something like that to be able to pull yourself up on. In this example, they have two chairs because the lady is going to pull herself up on one chair, and then her family member is going to slide the other chair up underneath her bottom as she's kind of pulling herself up. So I'll let it play just a little bit and then I'll stop and kind of explain. Does that work for you? Okay.
Yes, that sounds great.
Okay, perfect. Let's play it for a little bit. So she's putting her upper arms in here. Let me pause it again just for a moment. You want to also make sure that while you're getting ready to help somebody up off the floor, you want to make sure that there's no significant injury, that there's not any broken bones, that are not bleeding from somewhere. Of course, if something like that is happening, you want to seek medical attention. You don't want to be trying to get them up by yourself because there's underlying issues going on that you could actually make worse. So,
Can I ask something before you? Sure. So if someone is by themselves, then, and they see blood or they feel blood or they think,
yeah, they should.
they need to call someone.
Right.
Try to not try to get up.
Right,
Okay.
right. If you feel like something is hurt, or sometimes people say, oh yeah, I felt it when I had the fracture, or I knew right away it was fractured. Don't try to get up. Call for help, because as the EMTs are getting there, they can help stabilize everything and make it less of an injury than what it could be by starting to move around. So yeah. Okay, let me kind of go a little bit further here. Okay, so I'm going to kind of fast forward it a little bit since you guys can't really hear the sound. They're going to start working on getting up here. So right there, she was laying on her side and then used her hands to kind of roll and get herself over. And then the family member or friend was helping kind of with the backside of her pants there to give her a little support. And now she's in hands and knees. So that's where we want to be, is in hands and knees. If you don't have a place where you've got something like a kitchen chair or something you can bring, once you're in this position, if you can crawl over to like the sofa, or if you're outside, if you have something sturdy that you can grab a hold of, if there's a pillar, if you're in next to the porch or something, and there's a pillar that you can grab a hold onto, or near a fence post or something like that that's sturdy, the same kind of idea that you want to use to be able to pull up on. All right, we'll go again. So now she's gotten herself a little bit closer to the chair. She's kind of on hands and knees. If you were by yourself, at this point, you would take your strongest leg and kind of pull it forward and be able to put your weight through that leg and kind of push up and turn your bottom and be getting on the seat. But because she has this person here to help her, as she starts to get her bottom up, then the second person is going to bring that chair up underneath her bottom to give her a place to sit. So we'll play again. So here they're talking about from the perspective of the person on the floor. Right now, she's kneeling down on the carpet, which makes it a little bit easier on those knees. But if you were getting up on hardwood floor or concrete or tile or something like that, it may be beneficial to use, like she's got a towel here or a pillow, or maybe want to pull one of those couch cushions down and be able to use that on your knees just to make it a little bit more comfortable. Okay, so we'll go again. She's bringing her strong leg forward now. So as she was starting to come up on that one, did you see how that lady kind of grabbed her pants and was able to kind of guide her bottom back to the chair? So now if you don't have somebody there and you are doing this by yourself, you would kind of just turn and sit in the same chair that you were leaning up on. So again, if you're hurt and you know you're hurt, you had something, you heard something pop or something like that, or you're bleeding or something, you want to definitely call and get help, because you don't want to injure yourself further than you possibly could be. So again, that's with two people. Having that second chair in there is a good plan. If not, always can use that first chair. If you've tried a couple times and you just don't have any more energy to be able to do it, please call for help. Don't wait for somebody to stumble across you. Call for help and go from there. So, okay, so now we'll go. Maybe. There it is. Okay. So then the next thing, some exercises that we like to use in the therapy department to help people maintain mobility and maintain strength. These are just a few, but it's important to stay mobile so that you can stay mobile, keep your balance. Maybe you won't end up on the floor at all, but if you do end up on the floor, it will make it easier to get back up. So the first one is a bridge. So it's just laying on your back. This picture shows the lady laying on the floor, but you can even do it on the bed. I would not get down on the floor and do it. I would do it on the bed or something, couch or something like that. You're just going to bend your knees up, and then you're just going to lift your bottom up and down. A good place to start is start with 10. If you feel like, oh, 10 is really easy, well, then you can up it and do 20. And maybe do it a couple times a day. Do 10 in the morning, 10 in the afternoon. Oh, that's easy. So I'm going to try 10 in the morning and 10 twice in the morning, and then 10 twice in the afternoon. The next one is a sit to stand. These are some of my favorite exercises because we can use them for everything, right? You've got to get up off of the bed. You got to stand up to get off the bed. You got to stand up to get off the toilet. You got to stand up to get off the shower chair, the sofa, any of that kind of stuff. So this lady is pretty advanced because she's not using any hands to stand up. But I would start with put both hands down on the chair or the bed, wherever you're coming from, and just be able to stand up and sit down, stand up and sit down, and work yourself, start with about 5 of them, work yourself up. Then I can do 10 of them. Again, do those like twice a day, once in the morning and once in the afternoon. When you do start doing these, you want to do them in a chair like the picture shows that does not have any wheels. If your only choice is a chair that has wheels, then do it from the sofa or go to the toilet and do it from the toilet. A chair with wheels is really not a great idea. So after you are being able to get up and down easy with both hands pushing off of the chair, then I would try putting your arms out kind of like she is and using momentum to kind of go up and down as you're doing that sit to stand. So it would kind of look like this as you're doing it. Let me see if I can adjust this just a minute. All right, so you would start here in the chair. This would be the first part is up and then back down. Once that progression gets a little bit easy, then I would do like what the lady is, and you would have your hands out this way, kind of use momentum, help yourself up, and then back down. When these get really easy, if you want to make it a little harder, you can cross your arms over your chest and go all the way up and all the way down. So that's kind of a progression of those sit to stands to where you're having to use more leg muscles and a little bit more balance. So the next one on there is working on balance a little bit. So it's standing. My favorite place to do some of those balance exercises is at the sink, because you've got the countertop to hold on to, and then you can also put your hands around the sink. It makes it a little easier if you do need that extra input there. So that would look kind of like this. I would be standing on the countertop, and then I'm going to have my feet together and then close my eyes and see if I can balance. But I've got the countertop right here if I need it to give me a little bit of support. So start with your eyes open. If you can stand there for about 30 seconds, then maybe try the next time with your eyes closed a little bit and see if that'll challenge you a little bit. And then the next one I have is hip abduction. So your hip abductors are on the sides of your hips here, and they give you lots of input whenever you're doing balance and then you're walking. So this one is just a simple standing at the counter and kicking that leg out to the side and back in, kind of like a windshield wiper when you're standing up. So those are just a few kind of to start. It's a little bit of something. You got to start somewhere, right? So that's a good place to start. All right, and then. All right, and then I've just listed a few resources and support. So of course, like we said a while ago, if you do fall, you do feel that you are injured, or you're not sure that you're injured, please call the ambulance, go to the emergency department in case of that emergency. You want to be checked out just to make sure that you don't have any kind of injuries that could lead to something else problematic. You can always make a follow-up appointment with your provider at the clinic. Just let them know that I did have a fall, or I've been having multiple falls, and that you've been fortunate not to hurt yourself. But if you're having those multiple falls, you want to make sure that you're following up with your primary care doctor and make sure that they are looped into what's going on with you. There are wellness programs and some churches that offer exercise groups. There's exercises. Sometimes the Hondo Pool does exercises in the summer, those sorts of things. There's those resources out there. Just got to be able to look for them a little bit to find them, to be able to do those exercises and keep moving. If you do need more assistance, like if you're using an assistive device and you're having trouble with the stairs and stuff, sometimes churches and nonprofits can offer some of those help for being able to get those things taken care of for you, for modifications and making ramps. The Wesley nurse is always a good resource to use as well, for, getting in touch with, hey, is there an exercise group with this? Or do you know somebody that can help with a modification for that? That's a good place to reach out also. And then, of course, our physical therapy department. So, if you go to see your primary care doctor and you've been having some falls or that sort of thing, the primary care doctor can, or if you have a specialist too, they can also send you to the therapy department, and we can give you, after an evaluation, some more specialized things that are tailored just for you, rather than those generic things that I just put up here for right now. But those generic things are at least a good place to start if you're able to. And if you need something more detailed, you can always reach out to us here at the physical therapy department. So I think that's all I've got for today. Do you have any questions or anything? Anything that I didn't cover that you would like answered? No? Okay.
About being alone, so that you covered that.
Yeah. Anything you can think of, Jacqueline?
No, I think it sounds great. It's just so nice, even for myself to hear these things, just because it's applicable to everyone, all across all generations. So it helps the people that, like you mentioned, are have the most risk and, things like that. But then also their children and their grandchildren, everybody's got somebody aging in their lives that, it's helpful to know these tips and tricks. So, and I especially like the exercises. I mean, I think those are just good all the way around. I might try a few of them myself. Just because it's good to keep your body moving. If you don't move it, you lose it. Thank you, everybody, for joining. Thank you especially for those who attended in person. This was super exciting. And thank you so much, Tanya, for presenting. That was just so helpful to learn about and to know. Hopefully everybody took a little something away from that. I know I did, like I said, especially for those of us with aging parents, aging grandparents. It's just always helpful to be a reminder for them, and then to know for ourselves as we all age. So thank you, everybody. Hopefully we'll see you again at our next community event. Like I said, this was recorded, so we will post this and share it to our social media. And we are also starting a YouTube channel so that we can share these and they can be accessed at any time. So, okay, thank you so much, everybody, again. And y'all take care and be safe and have a great day. Bye-bye.